Welcome to the Cyber Health Podcast. I'm Stephen Perano, your host. We're excited to announce that we have a website up and running. You can go and check us out at cyberhealthmedia.com. Again, that's cyberhealthmedia.com. We're celebrating 1 year, so go and check out all our shows, our previous shows. You can see our guests, and if you'd like to be on the show, you can do that there as well. We're excited to introduce our guest here. I've known Kevin for 15 years. Kevin Cho Tipton is a nurse practitioner in ICU. He is a major in the National Guard, and he is a recipient of the U.S. Surgeon General Medallion Award for Public Health. Welcome to the podcast, Kevin.
Thank you, Stephen.
We met back in 2010,
More or less, yeah.
more or less, at another hospital, and you were also working in the ICU?
No, I was
Where were
an
you
orderly then. I was a CNA. I was finishing
you were
nursing
CNA.
school.
He was finishing nursing school. But see, the guy, he was always well-spoken and sharp. You wouldn't know what he was doing in the hospital. He had scrubs on, and that's kind of how it is in the hospital, right? When everyone wears scrubs, everyone is assumed they're a doctor.
Yes,
if you don't
adult
know.
pajamas, I like to call them.
Well, that's incredible. So in that process, furthering your education from there, you ended up at Regional, and I ran into you, a couple years ago in the cafeteria, I think
Yeah.
it was.
I think where everyone comes at one point in their career is the hospital cafeteria.
Right. And you were probably leaving. Were you leaving that morning
Yeah.
or something? I ran into you.
Yeah.
And we were able to spark up a conversation, and it's nice to know you this long. And I respect you as a man and as a professional. And you're here today because I really want to focus on talking about teamwork, talking about burnout, because as we mentioned, you and I have been in healthcare for a long time, through thick and thin, through pre-pandemic, post-pandemic. So let's talk, though, before we get into the meat of this conversation, the award you received by the U.S. Surgeon General.
Oh, yeah.
Let's talk about that.
I honestly, I'm very grateful. I'm not sure why I was chosen, but I do know that there were millions of people working their hardest, not just in healthcare, but in every field. And I hated the term healthcare hero, to be honest with you, because I felt like, no, we're not heroes. We're doing what we're supposed to do. I'm grateful that we have the support, but I felt incredibly guilty. There were people that had no work, were out of jobs, and in a country where we depend on health insurance to take care of us, they were also out of health insurance in a time where there was a health crisis that was taking a toll on entire communities. So I try to tell those very human stories about not just us, but mostly the people who were suffering, the patients, their families, and these folks that were out of work and more at risk of getting hurt and getting sick from a whole assortment of things, not just the pandemic, but from anything. And I like to think that those stories got the attention of the Surgeon General, allowed me to work more closely with their office. And Dr. Murthy wrote a book called Together, where he speaks about loneliness in America. And it came out essentially right when the pandemic began. And he through a lot of research amongst many resources and sources, found that about the risk of dying increases by about 30% if you're lonely. And that's different than solitude. Solitude is something that you seek, that you want to collect your thoughts. But loneliness is an epidemic that is very quiet and silent and hidden by social media veneers and often by the media in general. And it was that I think caught my attention about his work, and I think helped me form a connection with the broader society of these systems level issues in medicine that help to save lives, change lives, and hopefully change medicine for better.
Oh, it's beautiful. Now, when you say a system approach, and forgive me because I'm not too familiar, in my experience in healthcare, it seems that there's a lot of people up top, right, of an organization that make decisions that have no clinical concept or education. And they're looking at spreadsheets, and they have to answer to board members. So when you say you're going to take a system approach, how does that differ from that?
I think that it's exactly what you mentioned. It's the inclusion of clinical realities for patients and families that uniquely only people who work clinically can. I think that's a role that anybody that's ever taken care of a patient can do and offer the insights that are very human. And not to say that there isn't an importance for the spreadsheets and the data. There always is, and that's how we make decisions in medicine. It's how we decide how we can best set up an OR, how we can best staff an OR, how we can best staff a hospital. But there is something uniquely human about the non-scientific side of medicine, and that's the connection required to build trust. And I think that that can never be underestimated or dismissed. And it's how staff really do take care of people, not just disease processes. And I think thinking systematically requires the input of clinical people that have spent their careers doing this job.
Right. And that would be a key differentiator,
Yeah.
to what you're doing. And that's great. You speak about trust. Now, when you're in the ICU and you're managing a patient who's severely ill, whether it's with COVID or some other illness, how do you get them to trust you, and more importantly, their families to trust you that they're in good care in your hands?
I'm not perfect. No one's perfect. It's also often very difficult, and for I think for good reason. They have no reason to trust us other than our credentials and our adult pajamas, our scrubs,
Right.
that they recognize we work in medicine. But it requires us to find a way to speak to them at a human level, not speak over them, not to speak down to them. And it's something that is difficult. None of us are perfect at it. And I think everyone in medicine has found that way to do that, regardless of their job. But it requires empathy and compassion and divorcing yourself from the science of medicine and leaning really hard into the sociology, the psychology, and the very human-driven moments of medicine, and finding a way to connect with families. And it's also something that Dr. Murthy speaks about in his book. I hate to revert to his book, but it really did change my life, my perspective on so much, and it gave me hope in a time where I think we all needed it to help understand how loneliness impacts families, and also how you interact and connect with people through that window, and understanding how that loneliness informs so much of what we do and how we overcome it to find that connection and trust, especially with a patient and a provider.
We all get overworked, right? The term burnout, right?
Yeah.
So what would you say, or either for yourself or perhaps somebody watching this that could be a healthcare employee that is burnt out or lonely, what would you recommend? Any suggestions on how to get through that?
The levels of PTSD and post-traumatic stress in general from caregivers, professional or not, during the pandemic reached to proportions that were very, very, very similar to those in the military. I did deploy overseas once. I was very grateful for the experience and met a lot of folks that had deployed many times, often to very dangerous situations. And the parallels and the loneliness and of the experiences reminded me that sometimes you just have to talk to your peers, your colleagues, the people you work with. As much as you may love your family, if they haven't been there, it may be difficult to connect with them. So I would say to anyone who works in medicine who feels lonely, find someone you trust, a mentor, a colleague, a peer, that you can talk to that was there. And I would say that those conversations have helped give me hope more than anything else. And obviously, professional help and 988 is always available for folks too, is always there. But there's something very special about talking to someone that you trust and who saw the same things. It gives you, I think, a way to reset.
Mm-hmm. Definitely. Well, thank you for that advice. So you mentioned in your statement about deploying overseas. So how did you start that journey in getting into the National Guard?
That's an interesting story. I came here as an infant. I was adopted, born in Korea. My parents gave me a home. They raised me in a place that I was very grateful for, and in a way that I was very, very, very grateful for. My father's father served in the Army for a lifetime. He was in World War II, Korea, which I'll get back to, and the very early era of Vietnam. And when I was a CNA, right before we met at a nursing home, I met some Korean War veterans. And I guess I should admit it, a lot of it is guilt and a sense of obligation to do something to give back. I decided to explore ROTC, ended up joining at FAU, and Didn't think I could make it, but ended up going through with it and commissioning in 2012. First in the Army. I'd already finished nursing school, but there was no chance for me to be a nurse initially, and then transitioned to the Air Force a few years later. It was a journey, I guess, to use maybe not a negative emotion of guilt, but a complex one to do something meaningful.
Mm-hmm. And so, how hard is boot camp?
uh, Easier than you think and harder than you think at the same time. It also revolves around people and working as a team and realizing that you must be a follower as much as you need to be a leader. And I think that works in any aspect of your life in any field that you work in.
You mentioned you were originally from Korea.
Oh, yeah.
Can you tell us a little bit more about that?
Yeah, I was born there, but as I said, guilt is a constant companion in whatever aspect. Hopefully, in a positive one. But most of the country lives within 30 to 50 miles of North Korea, and realizing that my grandfather had fought there, along with hundreds of thousands of Americans, sometimes with no choice because of the era of the draft, kind of inspired me to do something, and also to think back about that time where, had they not been there, I wouldn't be here today. Thanks to my parents as well, I wouldn't be here today. I think those experiences informed a lot of what I've done, and given me a reason to be grateful for what I've been given, and hopefully help others have the same chances.
Wow, that's beautiful. Yeah. And so, within that, that's when you decided to join the National Guard.
Yes, I thought about going active duty at one point, but I've always had a little bit of ADHD, and so I do more than one thing at a time. So I felt that the National Guard was the best way to serve in a way that could kind of give some respect for the sacrifice of those who came before me, especially those who fought in Korea. Americans that went there are commemorated by a memorial in D.C. It says something to the effect of fighting for people they never knew in a country they never met, or something to that effect. I think it was the other way around, a country they never knew and a people they never met. And that stuck with me, because had they not done that, I would not be here today. And there's something incredibly, I think, meaningful in trying to repay that debt. Right. Personally, and I think a lot of people do feel that way still today for many things, not just in the military or because of war, but because of parents who gave them an awful lot, and teachers who gave them an awful lot, and that sense of gratitude.
Right, absolutely. And you mentioned that word teacher. My mom used to be a teacher. She's retired. I know teachers hold a special place in you. I follow you on social, obviously, and I see a lot of your posts, and I read, and you, just a couple of days ago, maybe it was 4 days ago, you had mentioned something about how without teachers, we wouldn't be here. And can you talk a little bit about any particular teacher, maybe that post that you did recently?
There's three teachers, I would say. The first one was one of my English teachers, Mrs. Glancy, in high school, who always encouraged us to think broader about the world. My friend Ashley, she's an attorney now, but she did teach for America, and she got to teach in some very at-risk neighborhoods and provide care, because in many ways these teachers provide care to kids to give them a chance for a better future. She would tell me how angry she was to see this kind of classroom to prison phenomenon, where poor kids especially, with very little resources at home, would get in trouble, and this would just snowball, and they would end up in jail far before their time. And she became an attorney, a public defender at one point, and now is an elected office trying to end that cycle. And the third one is his name is Chevron Jones. He's a state senator here in Florida, but also was a teacher, taught science, and also found a way to give back through hopefully a voice of uplifting the memories of his students and also the dignity of his students. Teachers uniquely provide so much care and insight into the world that I think can never be dismissed. And none of us, not you, not me, not attorneys, firefighters, it doesn't matter what profession. You don't even have to have a college degree. All of them had teachers that gave them a start, gave them inspiration, and hopefully a spark to do better, to be better, and to follow their dreams. And by the way, not just teachers, everyone that works at the school. I remember that the cafeteria workers would would find a strawberry milk for me. I mean, those little things made so much of a difference. My mom worked in the library at my high school, and none of those contributions can ever be forgotten. I think they're incredibly special and also very unique, um, not just for us as individuals, but as a community about how their impact has it on everyone.
Right, because are you still active with the National Guard?
Yeah, I am.
So let's talk about all the plates are spinning with you right now. You have National Guard, you have your day to day, right? I'm assuming you're also a mentor for many people because you have a lot of experience and your knowledge in different aspects, whether it's healthcare, military, or people in general. You mentioned to me before we sat down today, you mentioned that teamwork is a big thing for you, that guides you. And like you said, without a team, we can't accomplish anything. So that being said, let's get into some questions that I have for you that will kind of go alongside of this. One, we're going to lighten it up a little bit. Do you have any particular hobby or interest that might surprise people?
No, I'm pretty boring, to be honest with you. I would say that the most current thing is I'm rewatching a lot of 90s sitcoms that I grew up on, and I think that's a reminder of how things have changed, and I'll say it exactly the same at the same time.
Okay. Well. Let me ask you then. Because I understood that you are a really good pickleball player. Is that
No,
not true?
no, that's
It's
not
not
true.
true at all.
No,
Okay.
I would be lying if I said that.
Okay. Not pickleball. Okay. Well,
It would be a lie.
we lying.
I wish I was.
Right. It's a big fad, right? Everyone's saying that you play pickleball. I was like, no, I don't know. I eat my pickles. I don't know what they're pickleball, but it's something new, I guess. Everyone's playing pickleball.
Yeah, they are.
You mentioned a 90s sitcom. So is there any particular show that you use to de-stress from a long day? You go home and say, I'm going to watch that because that helps me escape from all the stuff I'm dealing with.
I hate to say it, but I've been watching Home Improvement and Pokemon reruns.
No kidding,
So
really?
cartoons and tool time.
All right. What what was his statement on Home Improvement? He just made the noise, "Arr, arr, arr," right?
Yeah, he
He
did.
didn't
He
really have
did.
a statement like a slogan.
He
He
did.
was just growling.
Yeah.
Yeah, what was that Tim Allen? I think Tim Allen.
Yeah.
All right, here's a good one. If you could meet any historical figure and have a cup of coffee with them, who would that be?
I would like to meet, if I could, President Eisenhower, because I think he had a very unique position in which he was a high ranking general in the U.S. military, but also was very cognizant of the military industrial complex. And I've always been very curious about how he could serve so long throughout his life and then also have this insight that he's willing to share with the country. And I think he and maybe Teddy Roosevelt. And my grandfather wasn't a historical figure, but for my dad, he was everything. I would like to meet him too, talk about it, just to get their insights and some wisdom about life, liberty, the pursuit of happiness, and
Sure. No,
see what they
that's
had to
great.
say.
Yeah, absolutely. Now, real quick, in Korea, did you ever visit Korea later
No,
on?
I've actually always been a little nervous about going back. One of my friends recently also adopted, went back. He really enjoyed it, but it's something that I have to develop the courage to do. I don't speak Korean. I speak English and whatever Spanish I've picked up from my friends. And for me, it's kind of an intimidating experience. From what can be known about North Korea, the stories appear to be true, especially from what the South Korean government has been able to uncover. There's a great deal of animosity between the countries, but also a sense of hope that they'll one day reunify. But you know, when the leader of North Korea died, you know, at the time, the what was left over of the Castro regime in Cuba was mourning his loss. So I mean, these are very uh, incredibly powerful figures in their countries in a very negative way, and something that I hope that the world can take ownership of and also rectify because people are suffering that don't need to be. North Korea, obviously people are suffering, but right here in America, in our own backyards, if you go to Miami, New York, any big city in the country, there are incredible areas of wealth and and right next door, there are areas where people are struggling to keep their homes. 1 out of 8 Americans are poor, and something like 30 million Americans lack health insurance. And of those 30 million Americans, often it's those folks who make just enough money at work to get by, but not enough to qualify for subsidies, and just so they don't get insurance. And the suffering is right in our backyards, not just overseas. And I hope that we can remember those very human aspects of it not just being far away, but right here at home.
Right. Right here at home, exactly. Yeah, sometimes we're so caught up in looking outside of what's going on in the United States. And you're right, we have a lot going on, especially here in South Florida. And what would be some of the best advice you were ever given?
To calm down, take a moment to think. I think by nature I'm a very energetic person. On social media, I try to be more calm because I know that I can sometimes be a little too much. Some of my best friends, some of my best coworkers have reminded me that sometimes you just need to calm down so you can make a good plan. And it's been the best advice I was ever given. Because when you're able to process things in a way that is thoughtful, it requires a little bit of peace in your mind. People who know me, who work with me, know that I try to be as unserious as possible because we work in a very serious, very sad environment. And being able to smile is sometimes very important, even for families that are suffering from the worst. But during emergencies, ironically, I'm often one of the calmest people in the room. At least I think. At least I like to think I am, and it allows all of us to process and do the best we can for someone else. And hopefully they will get home because of our calmness
Right.
and ability to process what's happening.
Right. No, I agree with that, and it's funny. I share the same sentiment. I think in my department, I'm in a level one trauma surgical unit, and you never know what's going to come through that door. From the most extreme emergencies to the not so extreme, I agree with you. I kind of share those same sentiments in work, and people know me, know that I stay calm because I'm able to process, like you said, when all the emotion from other people, whether it's the surgeon or the patient for that matter, going through pain. Um, I try to stay as calm as I can so that I can quickly figure out what is the best step to take for the patient, not for the surgeon, not for the business, but for the patient.
Yeah.
And I think that's very important. So I'm glad you're bringing that up because I see, and that's another thing when you're working next to someone, you mentioned teamwork, you'll find out right away how skilled or how confident your fellow employee is with you by the way they handle stress and outcomes that don't come or don't fruition into to where we want them to be, right? And I think that's important also to have a level of humility with a little bit of humor within regards and respect, of course, to the situation, right? So you're a big asset to the hospital, especially to your unit. And I was told by a couple people, they don't want their names mentioned, but they just wanted me to say to you, thank you. Thank you for all your services. Thank you for all those long nights, being there, being that go to solid rock of a person, joking around and making people laugh. But more importantly, reminding us that we're human. And to be honest, and I'm sure you can probably share this, agree with me on this, that not everyone's the same, right? We're a bag of Skittles in the OR and in the hospital, right? You have some people that are very highly strung out and super serious. You have people that are more relaxed and can focus and function that way. And then you have other people that are just looking to go home, right? Like, oh, another patient, I have to do this. Yeah, well, you signed up for, right? We take care of people. Well, I don't want to take care of him. He's smelly and hairy. Let me get the clean one over there, right? So regardless of that, thank you. They wanted me to tell you thank you. They're going to miss you greatly. And it's official that you're going to New York, right? So I can mention that?
Yeah,
Yeah.
yeah.
Okay.
A
So,
few days I'm leaving, yeah.
okay. So he is moving to New York and he's taking his skills, his personality, and all his knowledge to New York. So people in New York, you are very lucky to have Kevin there, and we're going to miss him greatly. I just want to make sure I got that out before the end of the episode. But moving back into our questions, can you describe a moment that somebody really inspired you? It doesn't have to necessarily be in healthcare, but just any particular moment. You know, maybe it was in a boot camp when they said, "Really, that's the only push-ups you can do." Can you give us one more?
I think in retrospect, my parents have been an incredible source of comfort that I've taken for granted. I think all of us take our parents for granted at some point. And as I've gotten older, I've realized that my parents were much more inspiring than I ever thought as a child. My dad was a truck driver for decades before he went back to school in his late 30s to become an engineer and then built roads for a living. My mom um, went to graduate school, and she was born in the 40s. It's not an era upon which most women were able to uh, go to graduate school. And I think that their stories, especially when I was overseas last year, my mom would send me these little voice notes to tell me some stories about when she was younger. I think those, in retrospect, are the most inspiring people that I can think of, and I wish that I had realized that at a younger age and appreciated that more. And I think that everyone who's grateful enough to have a parent or two um, will see that, especially as they, I think, move past their rebellious years.
Right, right. Right, because you can agree, right? We all get to that point and stage in our life where you're like, oh, my parents, they don't know what they're talking about. I know. Let me,
And they
I'll show
did. We
them.
just didn't realize it.
Right, right, exactly. So lighting it up a little bit, what makes you laugh?
Oh, what makes me laugh?
Besides Tim Allen from Home Improvement.
Irony. I think irony always makes me laugh.
Mm.
The irony in the sense that I can sometimes be very deeply unserious, but also serious at the same time, and people think that I don't know. I think people make a lot of assumptions about others, and when you have an ironic outcome, it's humorous and also kind of heartwarming at the same time.
Right, right. That's great. Now, I didn't ask you why healthcare.
I think that it was something that you can uniquely do that you use both your hands and your brain at the same time to help others, and it was something I kind of just fell into accidentally. I started out as a CNA, and I realized I enjoyed it, so I kept going and went to nursing school, and now 15 years later, I started from the bottom. Now I'm in the middle,
Right,
uh,
right.
but in a way that I think I still enjoy, and I'm able to help people.
Mhm. Now, up in New York, can you talk a little bit about what you're doing there?
I'll be working in a medical ICU like I have most of my career. It's a really great academic institution, one that I'm excited to join, and they do a lot of things that I've never done before. So it's an opportunity to learn and grow, and also develop new skills, hopefully, to help other people and also to find fulfillment in an era after the pandemic, which has been sometimes difficult to find. I think that PTSD, may sometimes makes it difficult for a lot of people to find purpose and peace, reset themselves,
Mm.
and I think sometimes following your dreams, finding that hope in the darkness, it takes some change, and this is, I think, positive change,
Right,
hopefully,
right.
for me and the future in general.
Sure. Yeah, that's great. And you're also going to get the change of seasonings, right? Seasonings. You're also going to get the change of seasons. Seasoning. You got special seasons up there too, right? You're ready for that, the snow and all that?
No, no. I own one jacket I got for $20 at the shop next door. I'll have to get some new clothes and throw away some of my flip flops.
Right. And you're going to have the what, mass commute, subways and buses, or right?
I
You're going to be in
actually,
the city?
I'm probably one of the few people that I know that actively take the train to work here in South Florida. But I enjoy it, and I'm looking forward to not having to drive for 2 hours to get 5 miles away from my house.
Right, right, exactly. That's a nightmare. And the good food. There's a lot of good food in New York. If you're a foodie, I don't know if you appreciate food or what sort of food do you enjoy the most?
Peruvian food,
No kidding.
yeah, it's an interesting mix between Asian and Latin American. It's very savory, and it's a really unique set of flavors that I think people should all enjoy. So yeah, there's gonna be some new seasonings in New York too,
Right. There'll be some
along with new
seasonings.
seasons. Yeah.
Right. So let's talk about technology real quick. We are a technology podcast. We have 10 minutes left here. First, I want to talk about technology that you use in healthcare and have you seen in the last 10 or 15 years it progress and change? How does it help you? How does it hurt you?
AI. I think that's the big key word on so much from the White House all the way down to everybody's house. AI is evolving in a way that is incredibly helpful and sometimes scary. But there's data that shows that radiologists and artificial intelligence can be very synergistic and find early breast cancers. And there's 13 out of 100 women will get breast cancer in their life. If they drink alcohol, that's like 17 out of 100 women. So I mean, there's incredible advancements with AI that can save lives, and we all have mothers and sisters or someone that's at risk for breast cancer in our lives. These changes and the breakthroughs that AI can provide us may be scary because it may be feeling like it's pushing humans out of a job, but it's also incredibly liberating and hopefully life saving. And I think that's the most exciting thing that I can think of right now.
Yeah, that's absolutely right. Yeah, and definitely the advancement of the technology helps spot and detect things earlier,
Hmm.
right? So you agree with me then on that sentiment that AI and technology is not going to replace us; it's going to improve and help us to move forward in healthcare and other industries. Now, on a personal level, I'm sure technology also helps you. Like I said, I follow you on social, and the ease from using your phone, smartphone now, compared to back in the day, you had to send an email or what was it,
Postcard.
postcard, right? Or the most fancy technology we had was iMessages. Just a quick
Oh, yeah.
message. You know,
Everyone had to make the perfect away message.
right, right. What was it? AOL,
Yeah.
AOL chat and stuff. Consider or talk about at all the safety aspect of technology when you're dealing with patients' records and information and being exposed or having a breach. Do you guys ever talk about that, discuss that in the department? Everyone has those cows, or they don't call them cows anymore. What do they call them now? The mobile,
The workstations, I
the
guess.
workstation,
Yeah.
the mobile desktops that you have to use when you're, you know, documenting patients' information.
I think if we don't discuss it, it's certainly in the back of our minds. I mean, hospitals have been hacked and held ransom by uh, really bad agents for money and for influence. I think it's a huge risk, but also one that we have to find a way to overcome and mitigate because uh, paper charting has gone by the wayside, and I think it's a good thing. When we have electronic records, we're able to provide continuity no matter where you're at. And as we evolve towards a more connected healthcare environment, we can avoid repeated tests. We can avoid unnecessary surgeries. We can avoid so much waste, and hopefully not only save money but save lives quicker.
Right, right, absolutely. That's the thing, saving lives. Yeah, as quick as you can, because, and you can attest to that. I mean, literally, sometimes you have a patient that you only have a few seconds, 30 seconds, to really make the right decision.
Yeah.
What medication to give? What is that arrhythmia they have there? Do we need to call for help? One thing I didn't touch on that someone asked me to, going back to the COVID era with the respirators and respiratory and those issues, did you see firsthand issues with not having enough supplies or equipment at any point?
I think the country did, and I certainly did. We were mostly we were strapped for personnel and spaces to work. There were moments when small hospitals of 100 or 200 beds turned their operating rooms into ICUs of people on ventilators. We had people from all over the country coming to help, and I think it was an incredibly gratifying experience to know that people cared, but also an incredibly scary one for families to realize that we were at a crisis scenario where people were passing away unnecessarily, and that we couldn't prevent that. But we tried. Um, it was difficult, but I think hopefully we learned lessons that will help us if there's ever a next time, then next time.
Right, right. And what was your opinion about the boosters? They had one after another, and at some point it seemed almost excessive. But what do you think about that?
I think it fed back into this the sincere desire for people to understand the truth, and also this baseline kind of uh, uh, fear of institutions, for better or for worse. I think if we learned anything, it's that health educators, health scientists, especially our leading health scientists, no matter where they're at, in Washington or state capitals or in community centers, need to find a way to better communicate health data to everybody. Too often, and I think we all know, like a member of a healthcare team that will talk too technically, to the point where a patient is too busy trying to understand where that word is than understand what the meaning is. I think that in health education in general, for everyone, we need to find a way to get back to the basics and be sincere, but also down to earth and grounded in our communication methods because all we do is confuse people, and that confusion hurts not only patient outcomes, but hurts people.
Hmm.
And we have to do better at finding ways to overcome that.
Absolutely. Right. Yeah, we all have to do better. Are you privy to the information that came out recently about them using technology with our cells to pinpoint and be able to either reverse or eradicate different cancers?
I heard something recently about mRNA technology being used to help to develop new cancer treatments. And there's incredible access to this information and these new technologies coming out. But it also kind of reminds me that yes, we must be better at these treatments, but we also need to get back to the basics in general. Having healthy food accessible to all families would help prevent so many of the issues we see today, from obesity to diabetes to heart disease. You know, these are things that we have to acknowledge here in America that are not uniquely American, but can be solved. We do need these new advancements in mRNA technology and cancer treatments, but we also need to find a way to get healthy food into every home in America.
Right. Absolutely. BCI, brain computer interfaces.
Oh, I don't know much about that.
Oh, right.
It sounds like Star Trek stuff.
Right.
As a Star Trek fan, I'm excited, but what is that?
So I think they have one chip they put in a gentleman who has severe neural disorders, and that chip has been successful so far, and he's able to navigate online using his mind and being able to go through websites, and it's very science fiction like. Of course, you can imagine there's a lot of concern by having access because, like we mentioned, with technology, for every piece of technology that's available that makes our life easier to access information, it also makes it easier for threat actors and other people that want to do something malicious. So, the concept of putting these BCI, brain computer interfaces, in people is concerning because of that simple fact that if you can't really secure the devices and technology we use now in our day to day, how are we going to secure a brain computer interface, right? Of course, that being said, is the evolution of technology and medicine, and the concept that I understood is these devices are being created because for certain patients there is no other alternative. Now, for the average person that is fortunate enough to not have to deal with these, you would look at it and say, that's absolutely insane. I don't want anyone drilling a hole in my head to put a computer chip. But then on the other side, you have family members and patients that they have no other option, or at least for now. So I was just curious if you knew anything about that or what your take would be.
I guess I know the science fiction of it. I've seen it on TV, but I would say that in general, medicine is reminds us to be open-minded, and also open to the science behind everything. I think it sounds like an exciting new concept. I'm not sure if I would jump on board, but definitely I think it's worth exploring. But I mean, I don't have kids. You have kids. You have
Right.
two kids.
Hmm.
I mean, would you want your kids to? I mean, our kids are in general, I think, are already on their phones too much.
Right.
Would they want to have a?
Right. Yeah, I joke around with people. The answer right now is no. I don't know much about it, but I think none of us really do, right? The effects and long term, just like with the vaccine, we don't know, right? We're all still learning. But that being said, I understand there is a need, right? And under the right circumstances, sure, maybe it could be an option or a discussion on the table. But that being said, technology in itself is a constant needle that's going to be moved. Um, um, and I guess it just really depends on who is the people that are overseeing it. And, at the end of the day, like we mentioned earlier, it's everything's a business and it's about money. And so, as long as I think the evolution of the technology in that aspect is outweighing the controversy, right, of the bad actors and the potential infection rate or the numerous problematic issues you could see with it when you're starting to enter in a personal in the brain. But then you can say, well, what about the people that did the 23andMe or 22andMe, right? So there's a huge database of information already of people's DNA, which also found interesting. If you look into that, a lot of people are not aware that most of the board members of that organization quit, which is kind of interesting. And
Hmm.
they quit abruptly. At the end of the day, we're hoping it's for positive change, like you said, right? We're doing to advance us as a civilization and not to have a bunch of mini cyborgs
Hmm.
walking around,
Well,
right?
I would say mRNA technology is exciting, but it's also not that novel. It's been studied for decades. It was just, I think, it was given the chance to flourish because of the money and resources and the moment. I think what happened during the pandemic was necessary, even if it was imperfect, but it gives us an opportunity to explore new horizons in vaccine technology. They use viruses to viral particles to give them more options in how they treat people. I think it's naturally scary, but I think at the same time, many of the biggest advancements in medicine and I think in technology were scary. I think that some of them in the military, like the nuclear bomb, incredibly powerful and scary. The cell phone. I mean, I can imagine how a parent may be incredibly worried what their kid's going to see on their phone, much less a device in their brain.
Right.
I think it's just taking advancements with a healthy dose of skepticism, and also
Mm.
ensuring that we all have free will and the choice, and not just the illusion of free will and choice, but making sure that people always have the choice. I was never a big fan of mandates of any kind, and I understand
Mm.
why I think governments think that's the answer. But at the end of the day, I can't force my patient to have a baby or have an abortion. I can't force my patient to be put on life support or not. It ultimately needs to be their choice, and I think that maximizing choice, enforcing barriers to obstructing choice are so necessary for healthcare workers, and giving patients every way possible to make a decision on their own is necessary, including with this new stuff coming out.
Absolutely, I agree. That's a strong statement. We need to continue to have free choice, right? Whether it's healthcare or in a personal aspect, right? And that's why I'm sure you can agree we feel blessed to be in America, right? That we have that free choice and not the illusion of free choice, which is a very strong statement you made because, right, you can take a step back and there's a lot of scenarios where you can scratch your head and say, was that a free choice or was that the illusion of free choice to bring us down this direction?
A lot of poor families don't have a good choice to make, and I think that's something that to go back to all the things we talked about. Free choice requires a lot of resources and time and energy, money, and I think it's something that we can all remember is very special. We should never dismiss the importance of, and something as simple as having access to good food or quality health care that enables free choice to live a healthy life, to live a life that you can, move beyond the Maslow's hierarchy of needs,
Hmm.
and to do whatever you want. And I think that's the free choice we have to focus on in America.
Right. Amen to that. Yeah. And well, you heard it, America. That was Kevin Cho Tipton giving you his philosophies in life and in healthcare and in the military and history. Is there anything else you'd like to share? Any message you'd like to share to your secret admirers, that your coworkers that you won't be seeing anymore?
I'll see them again.
Okay.
I'm staying staff relief, so I'll be back. But I think to people in general, no matter how dark things get in your life or in your community or for your family, I would just say remember that there's hope. Hope can always be found, no matter where you look. I think that was quoted in many movies. Harry Potter, I think, was one of them. In all sincerity, hope can always be found, and I think it's something that we have to hang on to because it can change lives and sometimes save them too.
Absolutely. Thank you for that. Well, that was a Cyber Health podcast. We hope you enjoyed it. I'm Stephen Perano, your host. And again, you can find us at cyberhealthmedia.com. We look forward to giving you more of these great episodes this year. If you'd like to be a guest, please go and check us out there. And again, thank you so much to my special guest, Kevin Cho Tipton, nurse practitioner. And we wish you nothing but success and blessings in your new venture down up in New York, excuse me. and bring us back some lomo sentado, right?
I will.
Right.
I will.
Thank you so much.
Thanks.
Take care, guys. We'll see you in the next episode.